Washington state legalized medical cannabis in 1998. Recreational stores are not required to be endorsed for medical sales. An endorsed store must have medical cannabis consultants on staff, have DOH-approved product available for sale, and must be able to enter qualified patients in the medical cannabis registry. 420-friendly has been endorsed since 2016. There are 12 qualifying conditions that have been identified by the state of Washington where patients may benefit from the medical use of cannabis products. The 12th category listed as a qualifying condition by the Department of Health reads: a disease that results in nausea, vomiting, wasting, appetite loss, cramping, seizures, muscle spasms or spasticity. Basically, this category is meant to cover any medical condition in which your healthcare team feels cannabis would be beneficial to treat your symptoms. A qualifying condition is needed for obtaining a medical cannabis authorization in Washington state. This allows patients to legally possess and purchase cannabis for medical use, including for managing symptoms related to their treatment condition. The Washington DOH oversees a voluntary medical cannabis registry. Patients can get a medical cannabis card from a medically endorsed retail store after receiving a qualifying authorization from a healthcare provider. Registration offers benefits such as excise and sales tax exemption on medical compliant products. A link to our video on how the database works and what you need to know about the benefits of having an authorization will be featured at the end of this video, or you can find it under the playlist Medical Cannabis. The program allows a qualifying patient to name a designated provider to purchase and/or grow cannabis on their behalf. Designated providers must also be registered and hold a recognition card. Cachexia, also known as wasting syndrome, is a complex metabolic disorder characterized by unintentional weight loss, muscle wasting, and fatigue. Cachexia is often associated with chronic diseases such as cancer, AIDS, chronic obstructive pulmonary disease, COPD, heart failure, and rheumatoid arthritis. Cannabis, particularly the cannabinoid THC, is used to manage wasting syndrome by stimulating appetite and alleviating other symptoms like nausea, pain, and anxiety. How cannabis may help wasting disease. Appetite stimulation. THC is a known appetite stimulant, often causing the munchies. It interacts with the endocannabinoid system in the brain, which regulates hunger and food intake, and can increase the hunger hormone, ghrelin. Nausea and vomiting relief. Cannabis can effectively reduce nausea and vomiting, which is a common side effect of chemotherapy and HIV medications that makes eating difficult. Pain management. Many chronic illnesses that cause wasting syndrome also cause pain. Cannabis can reduce pain and inflammation, improving overall comfort and potentially increasing energy levels. Mood and emotional well-being. Chronic illness and the severe weight loss of wasting syndrome can lead to depression and anxiety. Cannabis may help improve mood and promote a greater sense of well-being, boosting a patient's quality of life. Reducing muscle catabolism. Some evidence suggests that cannabinoids may help reduce the breakdown of muscle tissue by lowering pro-inflammatory cytokines, although more research is needed. It is crucial for patients to have an open, non-judgmental conversation with their care team about cannabis use. This ensures they are aware of potential drug interactions and safety concerns. Because state and federal laws on cannabis differ, it is important to understand the regulations in your location. The following terpenes may help manage symptoms of wasting disease, cachexia, particularly by stimulating appetite and reducing inflammation. Limonene. Limonene is known for its uplifting, citrusy scent and has been shown to reduce stress and anxiety, which can help improve appetite and overall mood. It possesses anti-inflammatory properties that can help combat systemic inflammation. This terpene may help protect the lining of the stomach, which can reduce feelings of nausea. Examples of strains high in limonene include Kush, Jack Herer, Super Lemon Haze, Cinex, and Wedding Cake. Beta-caryophyllene. This terpene is a powerful anti-inflammatory compound that interacts directly with the body's CB2 cannabinoid receptors to reduce inflammation and pain. It has been found to have gastroprotective effects and can help with digestive issues, which are common in wasting disease. By activating CB2 receptors, beta-caryophyllene can also help alleviate pain. Examples of strains high in beta-caryophyllene include Bubba Kush, Sour Diesel, Gelato, Chemdog, Death Star, and GG4. Linalool. Linalool has both anti-inflammatory and pain-relieving effects, which can provide comfort to those experiencing chronic illness. This terpene has tranquilizing and anti-anxiety properties, which can be beneficial for managing the psychological distress of wasting disease. Examples of strains high in linalool include Do-Si-Do's, Lavender, Skittles, Grand-Daddy Purple, and Amnesia Haze. Myrcene. Myrcene is known to potentially increase appetite. It exhibits anti-inflammatory effects that can help counter the inflammation associated with wasting syndrome. Myrcene can have sedative effects, which may be beneficial for improving sleep quality. Examples of strains high in myrcene include Blue Dream, Grand-Daddy Purple, Grape Ape, White Widow, and Tangy. Alpha and beta-pinene. Pinene is a potent anti-inflammatory agent that can inhibit the release of inflammatory compounds from immune cells. It can help reduce pain, which is often a symptom of chronic illness leading to cachexia. Unlike sedating terpenes, pinene may offer energy-boosting effects that can help combat fatigue. Examples of strains high in pinene include Dutch Treat, Blue Dream, Jack Herer, Harlequin, and Lemon Sour Diesel. Humulene is noted for its strong anti-inflammatory effects. It can help reduce pain and discomfort. Some people have reported that humulene may suppress appetite, while other research has not shown this effect. This makes it a terpene to use with caution if increased appetite is the primary goal. Examples of strains high in humulene are Death Star, Sour Diesel, Dog Walker OG, GG4, and Headband. For wasting disease, cachexia, the most helpful cannabinoid is tetrahydrocannabinol, THC, which works primarily by stimulating appetite. Other cannabinoids, such as cannabidiol, CBD, may also be beneficial for managing associated symptoms like nausea, pain, and inflammation. More research, including human trials, is needed to fully understand the endocannabinoid system, phytocannabinoids, terpenes and flavonoids, their effects, benefits, and optimal usage. How they all work together and in what combinations. While progress is being made, it is important to always consult your doctor before using cannabis to treat any medical conditions, as it may interact with other drugs, particularly those affecting the central nervous system or metabolized by the liver. It is known that certain cannabinoids may enhance the effects of blood thinners and sedatives, and it could potentially alter the effectiveness of antidepressants and immune modulators. Thank you for joining us. We hope this information has been helpful and that you'll join us as we continue to explore the potential benefits of this amazing plant. Please hit that like and subscribe button and leave us a comment and let us know if there are any other topics you'd like us to cover. Until next time. Peace.